So this is the structure of the eye. I got this photo from our textbook, and I'm just going to point out some structures that are very important. Let's first start with the layers of the eye. So as you can see, there's three types of layers. The first outer one is called the sclera, which also it also connects with the transparent cornea. So let's first start with the sclera. It is a fibrous coat with collagen fibers. It maintains the eye shape, and as I mentioned, it connects with the transparent cornea. That functions to it's needed for necessary vision because it's responsible for light refraction and light focusing. The middle structure, this one is known as the uveal tract, and it holds the iris, the choroid, and the ciliary body. And the most inner layer is known as the retina. And the retina is responsible for the light has to pass all the way to the retina. And then another important feature of the eye is the conjunctiva. And the conjunctiva lubricates the eye, and it protects by secreting mucus and tears. And it also lines the sclera. So another function or another structure are the lens. The lens is this right here. And the lens hides behind the iris, and it helps to focus light onto the retina. So the iris is the colored ring of tissue behind the cornea that regulates the amount of light entering the eye by adjusting the size of the pupil. So as I mentioned, the iris is right here, and the lens is right here. The next feature I want to talk about is the pupil, and this is where light enters the eye, and it is adjustable. The pupil is right in this structure. And last important feature I want to talk about is the optic nerve. Now the optic nerve is a bundle of nerve fibers, and that carries all the visual interpretation that we see that works within the eye, and it takes all of that and it carries it from the retina all the way to the brain. Now I'm going to talk about a common eye disease that occurs. The first one I chose to talk about is conjunctivitis, and as I mentioned, the conjunctiva does secrete tears and mucus, it secretes tears and lubricates our eye. So when that gets infected or inflamed, it can be due to a viral or bacterial infection, as well as allergies. Clinical manifestations include, we could see the eye being red and pink and swollen looking as well. Patients can complain of itchiness and irritation, along with discharge and pus. So diagnostic testings for conjunctivitis disease will include an examination of the eye, as well as reviewing the symptoms of the patient, and the physician could typically get an idea based on their symptoms whether they have conjunctivitis or not. So the treatment of management for conjunctivitis does depend on the type of conjunctivitis infection they have. So for instance, for antiviral medications would be applicable to a viral conjunctivitis. Antibodies would be used for bacterial conjunctivitis, and as I mentioned, allergies could cause this as well. So removing the specific allergen and having allergy medications would be very helpful. Some health promotions and teaching for the client. We want to educate that frequent use of the eye drop may cause sleep deprivation, as well as ensuring that they know the techniques for the medication administration. And also, we want to ensure that they dispose, we want to educate them that they should definitely dispose on any used lens or even cosmetic products, because we want to limit recontaminating and possibly reinfecting their eyes. Another well-known eye disease is called cataracts, and this affects the lens. And the lens, as I mentioned, is right here. So, this occurs when certain eye trauma, congenital factors, diabetes can also cause this, and as well as exposure to drugs. So typically, the patients will complain about a decrease in vision, and they will have blurry vision as well. Basically, the lens will have a cloudy appearance, and you could physically see that on the lens. So diagnostic testing for cataracts would include microscopic examinations, as well as a visual acuity measurement. And a visual acuity measurement is where the physician will tell us to, you see a letterboard and they tell us to close one eye at a time, and they adjust the letterboard according to where we could see, and it typically just measures our vision sharpness. Treatment and management for cataracts include prescription glasses, and patients are instructed or educated on increasing the light they have to help them see better. And if those two interventions do not work for them, there is a surgical therapy that includes the removal of lens, or extracapsular extraction, which is removing the cloudy cataract part of the lens, so removing like part of the lens. And then intraocular lens implantation, which is an artificial lens that they would put. Certain health promotion and teachings for cataracts is well, for starters, there's no prevention to cataract. So ensuring that patients understand the importance of protecting their eye from, especially from unnecessary radiation, is very important. We want to encourage antioxidant vitamins. For patients who do choose surgery or who need to go into that route, it's important for us to teach them proper eye hygiene, as well as signs and symptoms of infections, and the importance of following up their appointments. Last disease I want to talk about within the eye is retinal detachment, and it can be a medical emergency. So with retinal detachment, it does, as it says it in the name, it does affect the retina. And basically, this occurs when the retina pulls away from the epithelium layer, and this is not good because this is where the blood vessels supply the retina with oxygen and nutrients. This could be due to trauma, family or personal history, and can also be seen with increasing age. So clinical manifestations include photopsia, which is another term for light flashes. People will say they have a painless vision loss, that can resemble a curtain view, and people could also experience floaters in their eyes, so they could see like debris. They could see debris in their eye. So diagnostic testing for retinal detachment include, again, the visual acuity measurements, also direct and indirect ophthalmoscopy, and lastly, an ultrasound of the eye could also review if that retina did in fact detach, or the extent of the detachment can be seen from an ultrasound. And treatment and management include laser surgery to seal any tears in the retina or move the retina back in place. If it is left untreated, it can lead to permanent blindness. Now, health promotion and education include advocating for the patient when they are experiencing pain, lack of support, or an increase in anxiety from surgery, or for the possible leading to blindness. People could definitely be very anxious for that. So lastly is health promotion and teaching for retinal detachment. As I mentioned, the advocacy, of course, and it's important for us to tell them, or it's important for us to educate our patients that there is a chance of retinal detachment to occur in the other eye. So again, teaching them the signs and symptoms and what to look out for retinal detachment will really help. And then lastly, proper eyewear to help avoid additional trauma. We definitely want to tell them to avoid like exposure to UV lights or any unnecessary radiation possible for that. Thank you.